What if I told you that the way you are sleeping tonight could silently trigger a stroke before you wake up tomorrow morning? It sounds terrifying because it is. Cardiac surgeons are now warning that one common sleeping position is quietly choking your brain of oxygen, thickening your blood, and increasing your stroke risk by nearly 70%. And millions of seniors are doing it right now, tonight, without any idea that they are playing Russian roulette with their own hearts. I am Dr. Robert Hale. I have spent over 30 years in internal medicine and cardiovascular health, working with adults over 60. And today I am going to show you the two most dangerous sleeping positions that are silently harming seniors every single night, and give you 3 surgeon-recommended positions that protect your heart, open your airways, and keep blood flowing smoothly to your brain while you sleep. Before we go deeper, I need to ask you something. Have you ever woken up with a numb arm, a stiff neck, or that strange dizziness that makes you grab the wall just to stand up? Type your age in the comments and tell me yes or no. You will be stunned how many people watching right now have experienced this without knowing what it means. Subscribe and turn on notifications because what I share every week could genuinely save your life. Most people think sleep is passive. You close your eyes, your body shuts down, and 8 hours later you wake up. That is dangerously wrong. While you sleep, your body is fighting battles you cannot see. Your heart is pumping blood uphill to your brain. Your lungs are working to oxygenate every cell. Your spine is trying to decompress after a full day of gravity pulling you down. And your position, the exact way your body is angled on that mattress, determines whether your body wins or loses that fight. After 60, this is not just about comfort anymore. Your arteries are narrower. Your blood is thicker. Your heart works harder with every beat. One wrong sleeping position can turn a peaceful night into a medical emergency by morning. Let me tell you about Helen. Helen was 74 years old, a retired school teacher from outside Philadelphia. She had been sleeping on her stomach for over 45 years. Face down, arms tucked under her pillow, head turned sharply to one side. She thought it was the only way she could fall asleep. What Helen did not know was that every single night her neck was twisted at nearly a 90-degree angle for 7 to 8 hours straight. When you sleep on your stomach, especially after 60, you are forcing your head to rotate unnaturally just to breathe. This twisting compresses the vertebral arteries, the major blood vessels that run through your neck and feed your brain. A study published in the Journal of Stroke and Cerebrovascular Diseases found that prolonged neck rotation during sleep can reduce blood flow to the brain by up to 40%. 40%. That means for nearly half the night, your brain is starving for oxygen while you sleep peacefully unaware. But it gets worse. Stomach sleeping also flattens your spine into an unnatural curve, compressing your lungs and restricting how deeply you can breathe. Shallow breathing means less oxygen in your blood. Less oxygen means your heart has to pump faster and harder to compensate. Over months and years, this chronic strain raises your blood pressure, thickens your blood, and dramatically increases clot formation. Cardiac surgeons call this the silent stroke position because patients do not realize the damage until it is already done. Helen's wake-up call came one Wednesday morning. She rolled out of bed feeling dizzy. Her left arm was tingling. Her words were slurring slightly. Her husband called 911 with shaking hands. The doctors found a transient ischemic attack, a mini-stroke. The neurologist asked her one question: "How do you sleep?" When she described her stomach sleeping position, he said, "You have been choking your brain every night for decades." If you are a stomach sleeper, I need you to hear this. I am not judging you. I know it feels comfortable. I know it is hard to change a lifelong habit. But I am asking you tonight, please try something different, because your brain cannot keep compensating forever. Now let me tell you about the second dangerous position that sounds healthy but hides deadly risks: sleeping flat on your back with minimal pillow support. For years, doctors recommended back sleeping as the gold standard. Neutral spine, even weight distribution, no twisting. But for seniors, especially those over 70, lying completely flat can become a cardiac nightmare. Let me tell you about Walter. Walter was 77 years old, a retired firefighter from Atlanta who believed in discipline. He slept like a soldier, flat on his back, arms at his sides, barely a pillow under his head. He thought it was good for his posture. What he did not realize was that gravity was working against him every single night. When you lie flat, especially if you carry extra weight around your midsection or have weakened throat muscles, your tongue and soft palate collapse backward into your airway. This causes obstructive sleep apnea, a condition where you stop breathing repeatedly throughout the night. According to the American Heart Association, untreated sleep apnea increases stroke risk by 300%. Because every time your breathing stops, your oxygen levels plummet, your brain panics, your heart races, your blood pressure spikes, and over time, this nightly trauma damages the delicate blood vessels in your brain, leaving them vulnerable to rupture or clotting. Even without sleep apnea, flat-back sleeping causes another hidden problem: acid reflux. When your head is level with your stomach, digestive acid creeps upward into your esophagus and throat. Chronic acid exposure inflames the vagus nerve, which controls heart rhythm. Studies show that people with untreated reflux have significantly higher rates of atrial fibrillation, an irregular heartbeat that dramatically increases stroke risk. Walter's wife saved his life. She heard him stop breathing in the middle of the night, gasping for air every few minutes. She recorded it on her phone and showed his doctor. The sleep study revealed severe obstructive sleep apnea. Walter was stopping breathing 72 times per hour. His cardiologist told him bluntly, "You are one bad night away from a major stroke." The solution was not medication, it was not surgery, it was changing how he slept. So if stomach sleeping chokes your brain and flat back sleeping stops your breathing, what is the right way to sleep after 60? Here are 3 positions that cardiac surgeons actually recommend. Position number 1. Sleeping on your left side with proper support. Not just any side sleeping, but specifically your left side, with a pillow between your knees and one under your head that keeps your neck aligned with your spine. Why the left side? Because of anatomy. Your heart sits slightly left of center in your chest. When you sleep on your left side, gravity helps blood return to your heart more efficiently. Research from the Journal of Clinical Gastroenterology found that left-side sleeping reduces acid reflux by 80% because your stomach sits below your esophagus in this position. But here is the key detail most people miss. You need that pillow between your knees. Without it, your top leg pulls your pelvis out of alignment, twisting your lower spine and cutting off circulation to your legs. With the pillow, your hips stay stacked, your spine stays neutral, and blood flows freely all night. Let me tell you about Patricia. Patricia was 69 years old, a retired nurse from Michigan who had been suffering from high blood pressure and morning headaches for 3 years. Her doctor kept increasing her medication, but nothing worked. I suggested one change. Switch to your left side with a pillow between your knees. Within 1 week, her morning headaches disappeared. Within 3 weeks, her blood pressure dropped from 152/96 to 131/82. Her doctor was stunned. He reduced her medication. Patricia said, "I thought I was broken. I just needed to sleep differently." Position number 2. Sleeping with your upper body elevated at a 30 to 45 degree angle. This is especially critical if you have sleep apnea, acid reflux, or heart failure. When your head and chest are elevated, gravity keeps your airway open. Your tongue cannot collapse backward. You breathe smoothly all night long. According to the Sleep Foundation, elevating the head of your bed by just 6 to 8 inches can reduce sleep apnea episodes by 60%. You do not need a hospital bed. A foam wedge pillow, stacked firm pillows, or blocks under the legs at the head of your bed all work. The key is consistency every single night. Position number 3, the combination position, left side sleeping with elevation. You lie on your left side but prop your upper body up so your head and chest are higher than your legs. This is the recovery position hospitals use after stroke because it maximizes brain blood flow while keeping airways completely open. You need 3 pillows. 1 firm pillow under your head angled so your neck is not bent. 1 wedge or stacked pillows behind your back to keep you from rolling. And 1 between your knees for hip alignment. Here is your action plan for tonight. First, stop stomach sleeping immediately. If you cannot break the habit cold, start by sleeping on your side with a body pillow against your chest to mimic the pressure you are used to. Second, if you sleep on your back, elevate. Get a wedge pillow or raise the head of your bed. Third, try left side sleeping with a pillow between your knees for 1 week. Track how you feel each morning. Fourth, if you snore, gasp during sleep, or wake up exhausted, Ask your doctor for a sleep study. Untreated sleep apnea is a ticking time bomb. Comment below and tell me which position you are going to try tonight. Left side, elevated, or the recovery combination. I read every single comment. If this video helped you understand something nobody ever explained, share it with one person over 60 in your life. You might be saving them from a stroke they never saw coming. Subscribe for more evidence-based health guidance every single week. I am Dr. Robert Hale. The way you sleep tonight matters more than you think. Take care of yourself, and I will see you in the next video.